you for coming to our January meeting of the Health Committee. I'm sitting in as chair today for our leader, Mr. Joyce. And I think he's in travel status.
Yes.
And want to pray for him that he gets home safely, and want to continue to pray for the families of all those who lost family members in down in DC. Just keep them all in our prayers. So we're going to go ahead and call the roll for our meeting today.
Sure. Mr. Joyce and Beston are excused. McLaughlin?
Here.
Petto? Here. Miller?
Present.
Robinson? Lane?
Here.
Collins?
Here.
And Lockhart.
Here.
You have a quorum.
Thank you very much. First item on the agenda is approving our previous meeting minutes.
Make a motion.
Motion and second. All those in favor?
Aye.
Thank you very much.
Item 2 is withdrawn. Item 3 and 4 are tabled at request of sponsor. Item 5 is authorizing an agreement with Information Management Associates regarding patient and billing software at the Department of Mental Health. Dr. Giordano is here this evening.
Good evening, everyone.
Good evening.
Should I jump right in?
Yes, please do.
So the first item on the agenda for us has to do with the renewal of a contract with Information Management Associates. They are the electronic health record vendor that the Department of Mental Health uses. We've been working with them for 35 years, actually, since 1990. And this is an increase from last year of almost $2,500 in the contract. They have been very successful with us, and we have good working relationships. We have over 100,000 electronic medical records in the archive working with this company. And we ask that you consider approving the renewal.
So this is a 1 year,
Yes.
is it 1 year because, I mean, is it like an extender or is it always 1 year?
It's just, we've been doing it for 31-year renewals. So,
1 year at a time.
I hate to say it's always been done that way, but that's kind of the way we've been doing it.
Did you ever get any other bids?
So, interesting you should ask that question. We did, actually 15 years ago, put this out to RFP, and the challenges were associated with the archived records, that bringing in another vendor, there were many proposals. The note I wrote to myself was that the one that was closest to even considering was $1 million. And part of the challenge was because we have such a lengthy existing healthcare set of records. So we've not done it since then.
So would it be like starting over?
Well, it would be, and that's the challenge, that we really can't, because we are still accessing records from 20 and 30 years ago. Families that we might see, you know, we might have treated someone, an adult, way back when, now their child is coming through the system, or vice versa. We have requests for records all the time from courts and hospitals and other states, and it's the issue of being able to access those records in a timely fashion is pretty critical. And that's what no other vendor was able to convince us that they were able to do well. So we've not looked for.
So are there, I'm just, while I can see, you know, the benefit of what you're saying to the continuity, are there any disadvantages?
To this company?
Yeah. Or any other company were you to change at this point?
Yeah, I don't know that I could confidently talk about disadvantages.
I'm not
We
sure.
work with them very seamlessly, and we're happy with them.
Thank you, Madam Chair.
Mr. Lockhart.
I'm not a computer expert by any means, but isn't it a matter of just exporting files from one system to another?
Well, it's said that way, it seems very simple. Well, these are all proprietary vendors, and they all have different systems, and they all, 15 years ago, gave us examples of how they might do this, and none of them were able to confidently say they could do it in the way that we needed. The other thing I will add about this particular vendor is that they are an electronic health record and automatically a billing system. So where many of my counterparts around the state might have an electronic health record and then a separate billing system, when we enter a medical record, it automatically generates the bill, and it's really streamlines things quite a bit, and so that would be a plus for us from our standpoint. And again, the RFP was 15 years ago. It's a different world, probably, if you were to...
Dr. Giordano, what's the requirement for how long these records are required to be maintained?
Yeah, so the paper records, as I understand it, the public health law is 6 to 7 years on site, and then we archive them at the Hall of Records. But we're almost paperless at this point. So that's another reason why we depend so much on the electronic archive, so that it's not on site, it's in the.
But it wouldn't necessarily not still apply to the electronic records, though.
I'm sorry?
It would not necessarily apply to the electronic records,
No.
that you are only required to keep those
Correct.
back 6 or 7 years.
Correct, that's correct. We've talked to the law department over the years on this, and because we get requests for records, in no predictable fashion from legal entities and hospitals and around the country, the advice that I remember being given was, just keep the records. Now, the law doesn't require us to keep them on site more than 6 years. We send those boxes, or we used to send those boxes to Hall of Records, but we could get them within 24 hours if we needed them. The question of how long does the Hall of Records keep them is one that I can't answer. So we're not required to keep them on site, doesn't mean we're required to destroy them. So we transfer them to Hall of Records, and as I'm told, we have a whole section down there.
Thank you. Any other questions? Can I get a motion?
Motion approved.
Mr. Miller? Second. Ms. Peddle? All those in favor?
Aye.
Any opposed? Thank you very much for that.
Item 6 is authorizing an agreement with Second Chance Opportunities regarding substance abuse and narcotic addiction treatment services.
Thank you. So I would like to just put this in some perspective. Every October, I come before this committee to renew the state aid funding contracts that we have with our OMH and our OASIS providers. These are all 100% state funded. This is the way the state Office of Mental Health and Office of Addiction Services funds their community providers in every county in the state. The reason I'm coming to you in January with this Second Chance Opportunities, which by the way is not a treatment program, it's a recovery and support program, is because the state oversight agency OASIS has included it now in its state aid to this county. So this is $535,000 that the state has identified for Second Chance Opportunities, and it comes in our state aid every year with these other 9 agencies. So in October, when I bring to you the renewals for all of our addiction programs, that will be included. But this is a new state aid contract.
Okay. Yeah.
I've been told over the years to remind whenever I bring this up, it's 100% state funded. We're really just an oversight agent.
With this extra money, give an example of what you'll be doing differently.
I'm not doing anything with it. This is earmarked for a program.
It has a specific use.
And they're already operational.
Dedicated.
And
Okay.
OASIS used to directly contract with them, and now they've given the money to the county. And they are, just to give you a sense of, they are focused on promoting long-term recovery, skill building, employment readiness. They hire They have a whole janitorial service where they hire people in recovery who have maintained recovery. They have housing program. And this, as I say, this money used to be going to them directly from the state, and now it's coming to us. It gives us a little bit more oversight.
Ms. Lockhart?
Yes, Doctor, do we refer directly now to second chance opportunities?
We do not, this program is freestanding in the community on Colvin Avenue. They had last year, they had,
So we're a pass-through, is what you're saying, for the money?
the money is, we're a pass-through.
Just a pass-through,
Yeah, but
okay.
patients find their way to second chance through a variety of.
Okay.
And they have
Do we still get reports on how these agencies are doing in terms, even though we're pass-through?
Yeah,
Do we-
yes,
okay.
yes. And we
So you're-
will add this agency to that moving
Okay.
forward.
So this agency's new to you as well?
Free money.
They're not new to the community, they're new to us in terms of this relationship. Where before
A
we-
financial
Right,
relationship, okay.
and that is the leverage that allows us to say, show us what you're doing.
Okay,
And
good.
that's why the state works through local mental health departments in that regard. As I said, it's pretty standard across the state to do that.
Well, thank you, Doc.
Would that include information on individual participants? Would they, that you would have any interaction with them at any point?
The data that we would get, as I have something from what Oasis is collecting right now, is aggregate data. So they served 3,500 unique individuals last year, 8,000 contacts, 362 people a month. They delivered 166 programs in the areas of employment readiness, health and wellness, but we wouldn't be able to say, Steve Giordano did anything, it's all, protected information.
Well, all the county department of health, you would be able to, you have an interaction with them individually.
Oh, yes. Oh, the patient?
Yes.
I have no way of answering that. These are folks that are dealing independently with this agency. They run a transportation program as well. They have been identified by New York State as an agency to help people with insurance company problems. All those folks go to this program. We have no knowledge of who they may be. We just need the agency to tell us that they're meeting the expectations that the state puts on it.
Ms. Petto has a question. Do you have another question?
Yeah, just like, wait.
Thank you. The data that you provided was like Albany County data, regional data, state data?
This came from the state about this agency, which we've just inherited. I don't think they have, they're a regional recovery center, so those probably include people from outside of the county, although the way the data has always looked, as long as I've been here, is that about 80% of all of the services at the OMH and Oasis agencies were Albany County people, and 20% of the statewide data was Albany. There's 20% of our folks are going out of county, 80% are staying. And I would imagine that would be the same here, but we haven't looked at it yet. We will for 2025.
So recognizing this is a pass-through, I was wondering, are we then approving this funding, this pass-through funding for multiple counties, or are
We're
there
not
counties involved?
Sadly,
Also.
depending on how you look at it, we don't get to approve it or not. The state
Right.
gives it to us and says, please put this in your state aid for this. So our own quality assurance team tries to monitor the program as best we can, along with the state. The state licenses and certifies, they go in. Sometimes they tell us that there's going to be an inspection, we'll accompany, sometimes we don't know about it. But if you're asking, is some state money coming to Albany to serve people from outside of Albany County, the answer is yes. And historically, it's been about 20% of the people served in these programs that are regional. Not all the programs in Albany County are regional. Recovery Center is.
Ms. Trotsky had another question.
Yeah,
I'm sorry, Ms. Lockhart.
no problem. I don't mind, Vicki's a great person to be mistaken for. Those numbers that you cited, there's quite a few people who go through
Yes.
the program.
Yes.
Are they unique individuals,
Yes.
or is that
The 3,500 were unique individuals served,
Okay, thank you.
which is part of that.
It is, that's why I asked that, because a lot of times they count, every time they have contact, it's a new
Well,
number.
right, and so the next number was 3,500 people with 8,000 contacts. They
Okay,
were counting both.
okay.
Anyone else? If not, can I get a motion?
Motion to approve.
Motion, Miller. Second. Young man, what is your name?
Mr. Collins.
Mr. Collins. I'm sorry, I apologize. We don't interact a lot, but I won't forget.
That's okay.
It's been moved in second. All those in favor? Any opposed? Thank you so much. Can we get a motion to adjourn?
Motion.
Mr. Giardello, Dr. Giardello, did you have something else?
I did not. I would.
Okay, I thought you raised up like you had something to say. Okay. A motion to adjourn? Second? Motion in second. All those in favor? Aye. Thank you so much. Thank you. Was it Collins or Costello?